Have a look at this clinical question. So this one's an 8-year-old, and they're having to use their salbutamol nearly every day, despite being on steroids. You can see they've tried montelukast before, but it didn't get on well with them. And we've assessed that they're not able to manage a MART regime. Type into the chat, why might a child of this age struggle with the MART regime? So the main thing is that especially in this age group, the only option for a MART regime is the brand name is called Symbicort, but basically it's got the steroid with formoterol. Anyone know which steroid is in the MART regime that you can give to children of this age? Budesonide, that's right. Now, in that combination with Symbicort, that's only available as a dry powder inhaler. So they need to be able to take a deep breath in, coordinate that at the same time they take. A lot of children can't do that. And so there are other options if they can't do that, which can be used with a spacer, with a regular inhaler, with alternate choices. All right. When we get to adult MART regimes, there's other choices for the steroid component. The LABA is always formoterol, but you've got other choices because as well as budesonide for adults, you've got the choice of beclometasone. Okay. So the correct answer, if they can't manage a MART, is A. So a pediatric low-dose steroid in combination with a LABA and a separate salbutamol inhaler. Okay. So the actual drugs in this are the same as what's in the MART. What's different in the MART, though, is that you don't separately have a SABA, and you've only got, for this age group, that one choice, and it's got to be a dry powder inhaler. Okay. Whereas here, you could have a steroid, any steroid, with formoterol, and there could be a combination inhaler. That's usually what's given to make it easier, or it could actually be separate if you wanted to. Okay. So let's go through the guideline for 5 to 11. Do you notice the difference in age range? For diagnostic threshold, there's under 5, 5 to 16, 17 plus is adult. For management, it's under 5, 5 to 11, 12 plus is the same as the adult regime, basically, for management. Okay, so at the beginning, you've got salbutamol plus a pediatric low-dose steroid, for someone that needs regular maintenance therapy. Before that, they'd just be on salbutamol on a as-needed basis. And then what you do is, if they're not well controlled here, you assess, can they manage a MART regime? So could they manage one of those dry powder inhalers with the combination of, in this age group, there's only one combination, budesonide and formoterol. Formoterol is a fast-acting, long-acting beta agonist. So it's a LABA that's fast-acting. Okay. If they can manage it, then that's what you do, is you put them on a MART. So with the MART, they now no longer have a SABA, they no longer have salbutamol, they only have one inhaler. And the same inhaler, what does MART stand for? Maintenance and reliever therapy. So they just have one inhaler, which has got a combination of budesonide and formoterol. They take that in the morning, they take that in the evening. Or there are some regimes where it's just a once daily dose. But if they then get short of breath, they just take a few extra puffs of the same inhaler. There's no separate inhaler. So it simplifies things. But as I mentioned, not all children can handle a dry powder inhaler. And then if it's still not controlled, you just move up to a pediatric moderate dose MART. So it's the same drugs, it's just that the dose of the steroid is doubled. Okay, but it's still a combination inhaler. Still not controlled, refer to asthma specialist. If they can't manage MART, then it's a bit more close to the old guideline, but it's just that it's now one set pathway, whereas previously for this age group, there were differences as to what goes first between NICE and SIGN BTS. So if they can't manage MART and they're already on a steroid, salbutamol PRN, the next step is add in a leukotriene. So they're on montelukast alongside the pediatric low-dose steroid. They've still got the salbutamol, so they take this regularly. They take salbutamol if they get breathless. Not well controlled, go to pediatric low-dose steroid with a LABA combination. So that was our patient, right? They tried leukotriene before, it didn't work. They were still on the pediatric low-dose steroid. Didn't work, you go to this. So pediatric low-dose steroid with LABA. You can see that's actually the same drugs that's in this, okay? You could keep the leukotriene if they tolerated it and it helped. You could stop the leukotriene if they didn't tolerate it, which was our patient, and then they have a salbutamol as a PRN basis. Still not controlled, you go to pediatric moderate dose steroid, so i.e. the dose of the steroid doubles, and you still got the LABA. Again, if the leukotriene was tolerated and helped, keep it. If not, stop it. They've still got the salbutamol on a PRN basis. Still not controlled, now you refer them to an asthma specialist. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.